stress. And then they would have better coping and better ability to manage their physical health condition. And ultimately, if you're happy, you're going to have a better outcome. So your expectations are going to be in line with your medical or healthcare professionals' expectations. If you know more about your condition, there's more likely that people are going to adhere or be much more able to cope with their treatment. And if you know more about your condition, there's likely to be a bit more a decrease in terms of psychological distress. Because often people become anxious because they don't understand their condition or how to manage it. So how can I help myself, not just me, but you or other people? Well, I think the first step is to seek help when needed. So a lot of people struggle on their own without asking for help when they're feeling particularly overwhelmed with the demands of their physical health condition. We need to reduce the stigma surrounding seeing a psychologist or seeing a therapist, because our ultimate goal is to teach patients to be their own therapists in themselves. And it's not a bad thing going to see a psychologist, because what we see them as experts in their own condition. We only use our skills and expertise to help them to manage their condition. Social support is important for people who are struggling with life-threatening conditions or chronic conditions. So increasing your communication skills, speaking to your spouse, speaking to people around you, speaking with healthcare professionals, and making sure that you have a good social support network. Now, for a lot of people, that might also include your faith as well, so relying on your religious beliefs to help you through a difficult period. Education, education, education is important, because the more information you have about your condition, the more effective you can be at managing it. And I think it's important that people review their coping resources, because that can change when we develop a physical illness. So your coping style prior to having a physical health condition might be one of just ignoring it or coping with problems and hoping they'll go away. But that might not be effective when you're faced with a physical health condition. So I guess we encourage people or patients to review their coping resources, being able to ask for help from people when you need it, rather than just coping on your own. And I think that as psychologists, we've got to instill some hope in our clients or in patients that we see, because often when you're experiencing a lot of distress, whether you're feeling a bit quite depressed or anxious as well, that can also link to a sense of being quite hopeless as well. So I guess as therapists or psychologists, we carry the hope for our clients, because we're hopefully going to help them to talk more about their problems and think in much more helpful ways of problem solving. So I quite like this quote here, that hope is a wonderful thing, something to be cherished and nurtured, and something that will refresh us in return. It can be found in each of us, and it can bring light into the darkest of places. So I think hope is really important. I guess if we are thinking more about just seeing patients for life, that would be a bad thing. It doesn't instill confidence in someone that they can manage their problems on their own. So psychotherapy has to be short-term and time-limited. Okay, so in summary then, we've talked about some of the psychological issues in a range of medical conditions this evening. I've taken you through a bit about what we might include in an assessment, what a formulation is, about making sense of someone's problems that they might have in response to a life change. I've mentioned a bit about what we might do as a treatment, a talking therapy, depending on the presenting issues that people are facing. And Lynn talked a bit about her research at NUH and her placement experience there working as a psychologist. And so that naturally extends the role of a clinical psychologist to one of teaching and training others in psychological skills. So I guess it's up to us to increase the profile and the value of psychology within medical settings, not just mental health, but also physical health settings. And one of the things I did while I was training a couple of years ago was to do presentations here and there to medical teams, with the aim of increasing the value and the meaning of psychology within medical settings. And so research is important, as is clinical supervision, which is one of my roles at NUH. Okay, so in summary then, we know that medical conditions can generate psychological issues, and as such that can be linked with lower adherence. If people are anxious or depressed, they're less likely to stick to their treatment, they're likely to give up. And it means then that they might have an increased amount of distress. And that suggests that psychological support is really of value. Well, I believe that. I hope that you do as well. And I guess psychology should really be part of the comprehensive package of care. So in conclusion then, if we go back to the question, do we need psychology in medicine? Yes, we do. Thank you very much for listening and for coming. I hope it's been useful.
Do you want to answer questions?
Yeah, sure.
A lot of chronic conditions take some time before being diagnosed. Like a lot of people have to go doctors and doctors and doctors and do a lot of tests before. So how can they be helped in this sense? Like there is a place for psychology in this, like when it's still undiagnosed, right?
Yes.
So because I noticed you put a lot of emphasis on education, on knowing the condition and all that. So what happens when the condition is unknown?
I think where the condition is unknown, it's normal for people to go from one doctor to another as part in the early stages of trying to ascertain what the diagnosis is or what the reason is that you're experiencing some problem physically. But I guess the role for patients is in terms of asking questions and being able to be assertive and ask your doctor, why is it that you're sending me for this particular treatment? How is it going to help me? So we're hopefully going to teach patients to be their own advocates, being able to ask questions, not just going along as a passive recipient. Because I think that's where distress can arise in those early stages, because uncertainty can bring a lot of anxiety, not really knowing what your symptoms mean. But all you know is that your doctor is referring you from one specialist to another because they are trying to help you. So I would really emphasize the asking of questions, not being shy to ask your doctor questions or the nurse questions or asking a family member to speak on your behalf so that you feel in much more control of your current situation. Does that answer your question? Yeah, thank you.